everybody, I just want to go through some of the major blood vessels that we have surrounding the organs we just dissected. So what we have here in the neck region right here, you have your larynx, you have your trachea, you have your thymus, and your thyroid gland. Just underneath your thymus gland, we have two blood vessels, and usually the dye runs through both of them, but we have a blue one and we have, sometimes it's pink, sometimes it's more neutral colored. And these two vessels, the blue one is the internal jugular vein, and the neutral or pink colored one, this would be your common carotid artery. It is bilateral, so we do have it on the other side too as well. And we can see here that we have right here, we have the two pairs right there. We have the blue one is the internal jugular vein, and the neutral colored one is going to be the common carotid artery. Now, as we move down, we look at some blood vessels that we can see in the chest cavity. And we have coming into the heart here, you have your superior vena cava right here, okay? And then if you have a superior, you're going to have an inferior vena cava. So you have your inferior vena cava just piercing through that diaphragm right there. Both of those inferior vena cava and superior vena cava converging on that right atrium there. If I take the left lung and I pull it over to the side here, you can see we've got the aorta, okay? You can call it the descending aorta. We'll just call it the aorta for now. Not to be confused with the esophagus that we saw earlier. As we get down into the pelvic region, here, and we get down to here, we had seen the rectum, which was the end of the large intestines right here, but I had also gone through two other blood vessels. You have the aorta again. This would be the abdominal aorta. So let's be specific. Yeah, let's call this one up on top. We're going to call this one the thoracic aorta. And then down here, we're going to call this one the abdominal aorta. And then you have your inferior vena cava. So second place to tag your inferior vena cava here. All right, and that is the major blood vessels that we'll cover on your pig dissection.